We introduce you Toxoplasma gondii.
The life cycle of Toxoplasma gondii occurred in rats, which make rats as a carrier of the infection of this microbe. The muscle or organ of other infected animals, such as rats, are then consumed by cats, which is the immature forms of Toxoplasma gondii. Toxoplasma gondii then transmitted to human by physical contact, which can cause toxoplasmosis. Pregnant women are more immunocompromised to the infection. The prevention is divided into two, which is for the cats and for the humans. For the cats, first, keep your cats indoor. Second, do not feed your cats raw or undercooked meat. For humans, first, always wash hands after contact with farm animals, pets, animal feces, and animal environment. Second, keep food preparation areas clean. And lastly, cook and store food at appropriate temperature.
In toxoplasmosis, cats play an important role as the end host, right? Because they produce the oocysts. But then we have to remember the mode of transmission. There's three modes of transmission, right? From the oocysts, right? That's when direct through oral fecal route, and then tissue cysts, right? Tissue cysts is when the other animals they eat contaminated food or water, and then the parasite will become cyst in their muscles or in the brain, and then that's in the form of bradyzoids, right? So if you eat the meat, you'll eat the tissue cyst, right? The third way is through vertical transmission, which is from the mother to the fetus, from the placenta, right? There's three forms of stages, which is the tachyzoid, so that's the third one. So that's why from pregnant women, sometimes they can transmit to the baby. That's the third stage. So sometimes people think that cat is the only important route, but actually it's not. So you have to think of all the other mode of transmission. So like oral fecal route, usually people get from gardening, right, or from contaminated water sources. So if gardening, if you use bare hands and you don't wash, whether you're adult or children is the same. And then if you ingest, then that's oral fecal route, right? So if the second one is the meat through undercooked or uncooked meat, sometimes there are people who likes to eat raw or rare, isn't it? Medium rare, you still have the blood and stuff like that. That one is high chances. Even I think, I'm not sure, but even like fish, like sashimi, I think our quality we have to be a bit careful. So those are the things. So I'm just saying that if you want to do toxoplasmosis in cats, you have to remember cats are not the only way to get toxoplasma. They're just the end host, but you actually get it more from undercooked, overcooked, or from the environment actually. Usually cats positive toxo, or even other animals, they don't show signs unless when they're pregnant and they're immunocompromised, somehow the infection can become active. The tissue cysts will break and become stachyzoids, and then you'll see some abortion. Then you know, that's how you see that they are infected, or else the animal actually is healthy. If there's any abortion in animals, especially in production animals, it's very hard to diagnose. At the moment, we don't have. We have serology and PCR, but it's not routinely done, right? So usually those people who have research in that, then only they do. So for small animals also, if I'm not mistaken, they have specific test kit, which is not commonly practiced as well. For the oocysts, it's not easy to be detected, alright? Usually in cats, they don't, you can't catch them producing the oocysts. You can hardly get a production of high oocyst count. It's hard to differentiate the oocysts from the other coccidia. For treatment, I think sometimes in acute cases you can treat with some drugs like clindamycin and some sulfadizine drugs, but in some of the articles they said only during the acute cases. There's no cure for toxoplasmosis, I think, because of the presence of the cysts in the tissue muscles especially. Because you would not know unless you can catch the antibody titer, alright? But sometimes the antibody titer do go down, so only during active stage infection you get high antibody titer. Sometimes you don't get high antibody titer if it's a latent infection. So usually if you're pregnant, we would advise you not to handle the litter tray. You try and get somebody else to throw the litter, alright? It's best if you can you clean the litters every day. Don't wait for a few days, alright? So try to clean it every day, daily, and try to get somebody else. If you can't, make sure you clean your hands properly after you clean up. Me and Dr. Rosayan, we're in large animal, so we're planning to do small ruminants. Toxoplasma is one of the main cause of abortion in sheep and goats. So it can cause abortion. So I like to see what's the rate of that in Malaysia especially.